A new state report shows the number of Californians living with Alzheimer's is projected to double by 2040. Jared Giarrusso is the state government affairs director for the Alzheimer's Association. And Jared, the report shows that 1 in 6 Californians over the age of 65 will develop Alzheimer's and 1 in 5 will develop dementia. Why are we expecting to see such a significant rise?
Yes, well, thank you so much for having us. We see that we with the Alzheimer's Association see that age is the number one risk factor for individuals developing Alzheimer's. And with the report, which aligns with other statewide research in this area, we see that the amount of individuals living over the age of 65 will double by 2040. And it's important to look at that in relationship to the population growth in California. Over the same period of time, the state's population is only slated to grow by 16%. And so the report shows 127% increase of individuals living with Alzheimer's. So that aging population making up a larger proportion of the state's population is one of the main reasons why we see that this increase is slated to happen.
And the report also shows that some communities will be disproportionately affected by Alzheimer's, specifically minorities. Tell us about those findings.
Absolutely. So the report shows that for Black and Latino individuals living with Alzheimer's, that their numbers will triple in the next 20 years. And Asian Pacific Islanders will see those numbers double over that time. Additionally, the report showed that folks living in the Black and Latino communities are shown to get diagnosed later, which can have huge impacts to their costs, their out-of-pocket costs, their health plan costs. It's one of the reasons why we've really been focused on access to timely diagnosis and have advanced state policy to help individuals receive that timely diagnosis. So the report really shows those impacts and those growths. We also look at Alzheimer's as a public health issue because of those community-based impacts. And so we really want to see a broadening understanding of Alzheimer's in communities, destigmatizing the disease and helping people understand what their risk factors potentially can be as well.
And some might not think about this as well. What about the caregivers and the toll it takes on them?
Absolutely. Well, caregivers are so often family or loved ones of those living with Alzheimer's. Right now in California, there are 1.6 million Californians who are providing care for a loved one living with Alzheimer's. And that care is typically unpaid care. In addition to that, that responsibility falls more on women who 60% of unpaid caregivers are women, and folks in the LGBTQ community who are more likely to be caregivers as well.
Can you break down the difference for us between Alzheimer's and dementia?
Absolutely. So dementia is a general term for the decline in mental ability, severe enough to impact daily life. Alzheimer's is the most common form of dementia, and it accounts for anywhere between 60 and 80% of all dementia.
And you're having some Alzheimer's walks here in the Bay Area to raise awareness. Tell us about those.
Absolutely. So these walks are critical for helping raise funds for our association, which provides care, support, and research. 2 of those walks are slated to happen in the Bay Area in the coming weeks. So October 23rd is our East Bay Area walk in San Ramon, and on November 6th, our San Francisco walk. So we encourage everyone to join us and support the cause. You can find out more at alz.org/walk.
And of course, this report can open some eyes as well and get more people to come out and support those walks. What would you say are the most important takeaways from that report?
Yeah, so getting back to the original point, first, the aging population in California is slated to grow exponentially, and that will impact the amount of individuals living with Alzheimer's. Secondly, they will make up a larger proportion of the state's population, with the aging population growing so much larger than other age demographics of the state. And then lastly, as we touched on, Alzheimer's continues to have a disproportionate impact on communities of color. And it is so important for us to recognize that in our policy engagement in the state and in our federal government.
And you touched on this a bit, but what is unique about minority communities that increase their risk?
Yeah, so our Alzheimer's Association research indicates that there is some evidence of links between brain health and heart health. So while research continues to advance our understanding, we believe that those higher rates of vascular disease in Black and Latino communities may put them at greater risk for developing Alzheimer's.
And you even say that some counties may see greater increases than others. Why is that?
So the report shows that in every county, the rates of Alzheimer's are slated to increase, but the counties that have larger aging populations and are more diverse counties are slated to see even larger increases over the next 20 years.
And what about death rates, Jared? Are those expected to rise as well?
Yes, unfortunately, at this point, Alzheimer's is a terminal diagnosis with no known cure. So as we see the rates of individuals developing Alzheimer's increase, we will see the rate of death related to Alzheimer's increase as well.
And can you talk about the costs associated with Alzheimer's?
Yeah, so there are huge costs across all sectors. For our state plans like Medi-Cal and Medicare, we would see increases, for example, to individuals living without a diagnosis who are covered by Medi-Cal. We'll see an increase of 2.5 times higher of their costs. So individuals living with the disease and not being diagnosed will have increased costs to themselves and to those Medi-Cal plans. In addition to that, we see health plans increase in terms of costs as well. But I think what we really like to look at is that individual impact, particularly to caregivers. As we mentioned, 1.6 million Californians currently today are caring for somebody living with Alzheimer's. We would see those numbers increase over the next 20 years as well. And individuals who are providing that unpaid care, not only does that reflect costs to them, so typically anything around $10,000 out of pocket for the majority of individuals providing that unpaid care, but a loss of productivity. If you're helping care for somebody that you love with Alzheimer's, you're not going to be able to work in the same way. You're not going to be able to be as productive to our state, and we would see increases to our increased financial impact to our state related to Alzheimer's as well, and that loss of productivity.
And with everything we've been discussing, what are state policymakers doing to address the projected rise in Alzheimer's disease?
Yeah, we've been really fortunate in California to see such a focus on this issue. Last year, the state convened a master plan for aging as well as an Alzheimer's prevention and preparedness task force. Both of these processes were led by the governor and had key stakeholders help provide policy recommendations that had a 10-year life cycle in our state's policymaking process. And that included looking at the caregiver infrastructure, health-related costs, housing costs. It was a number of very broad policy recommendation processes. For the Alzheimer's Association, we took a lot of those policy recommendations and advanced them this year in our budget process, in California's budget process. So we saw increased investments into public awareness, into helping individuals receive care and helping caregivers. It was a phenomenal investment that we saw. In addition to that, we saw policy advancements as well. The Alzheimer's Association partnered with Senator Monique Limon, who is a state senator on the Central Coast, and we advanced SB 48 to help individuals who are covered by Medi-Cal receive a timely and accurate diagnosis. And we're excited not only for what we saw this year, but in the next year as well, because we believe that this issue continues to be relevant. It continues to have impact on our state and on individuals. And we think that a report like the one that was just released by the Department of Public Health helps us further the conversation.
Yeah, and why would you say this information is so important for all of us as a whole?
Yeah, so obviously with respect to the policy making process, it's important for our legislators and the governor to continue to understand not only the impact and the growing impact that Alzheimer's has on our state, but in addition to that, the impact that it has on communities of color who in so many ways have health-related impacts like Alzheimer's and dementia. But in addition to that, it's important that we continue to educate individuals, not only policymakers, but communities to understand what Alzheimer's is, how to hopefully receive a diagnosis, how to be able to care for yourself through the process. Those things are important as well, because they make such a big difference in an individual's life.
Jared Giarrusso, thank you so much for your time. We appreciate it.
Thank you.